This is why hysterectomy doesn't cure endometriosis. For so many women, a total hysterectomy is advised by their doctors, and that is absolutely fine. It might be the thing that really helps them to get symptom control of their severe endometriosis. If I show you in my female pelvis, remember this is the womb, and then on the side you've got the ovaries, and endometriosis is cells similar to the lining of the womb which get deposited outside in the pelvis, and then they scatter around causing scar tissue, adhesional tissue. They form endometriomas, which form their own level of estrogen and also have their own way of sustaining themselves and growing. So the advice of having your organ removed, so your hysterectomy removed, is fueled by the idea of getting rid of the diseased organ, and then that will remove the disease itself. However, unfortunately, that isn't the case, and this is highlighted by so many stories that I hear in my clinics and also from patients as well. We know that by removing the uterus, that is only part of the problem, because what happens is you can get implants of endometriosis or endometriomas scattered elsewhere in the pelvic cavity, and if you're not removing those through excision precision surgery and you're leaving those behind, then you will get, so the womb is gone, but you will get scattering of endometriosis either on the rectum, on the bladder, even on the bone, on the ligaments, even on the vaginal tissue that's on the inside as well. And often if you are having a different type of hysterectomy, and there's so many different types. So very quickly, let me just show you the types that we have of a hysterectomy. One is just where the uterus is removed with the cervix alongside that. One is where you can have the ovaries removed as well. So that's known as a bilateral, so both ovaries, salpingo oophorectomy. And sometimes you can get what's known as a subtotal. So you might even get the womb removed, but the cervix is left behind. So there are different types of hysterectomies that can happen. It's so important that you speak to your surgeon, knowing which type, what bits are going to be left behind and what is going to be taken out. Mostly in younger women, especially in their 20s, they opt for a hysterectomy as a means to gaining relief of their endometriosis. And it could be that they leave their eggs or their ovaries behind, because by that way, then it means that they are sort of protected against going into surgical menopause, which has its own level of implications and problems. So therefore, having a hysterectomy means that you're not going to guarantee that all the microscopic lesions of endometriosis which are left behind in the pelvis will go. So what I find is many years down the line, patients come back and they're having vaginal bleeding. And usually this is because they're bleeding from the endometriotic lesion. So any patient that has a history of endometriosis, if they get vaginal bleeding, please think it could be that their endo has returned. I'm really sorry, but that is the case. And I know I look like a crazy woman trying to explain this with my pelvis sat in my car. Someone's just given me a very odd look as they've walked past. But as always, if there's any questions, please leave them down below and I'll answer as many as I can.